Okay, thank you very much. So I'm going to call to order the Ambulance Committee for the Tuesday, September 23rd, 2021 meeting. Just in case you are all wondering, the previous governor had executive order which allowed us to meet by Zoom, which he then canceled. And then for a period of one meeting, we had to meet in person. Reissue the executive order so that we are allowed to meet by Zoom remotely, provided that we both stream and record the meeting, which is what we are doing. And you can see that in the upper left-hand corner of your screen. This executive order only lasts until mid-January. So mid-January, we may be faced once again to see what this situation is going to be. Okay, the first item is supposed to be the approval of July 27th meeting minutes, which I don't have a copy of. And Marie, you said it's not independent. There is no.
Yes, yeah, it's not independent. For this last month, I made them all one set of minutes for the REMSCO.
Okay.
And I hope everybody got that.
Can we postpone that to the REMSCO meeting? Does anyone agree that we can do that entire item in the REMSCO? Hearing no disagreement, I'll go on. Okay, the next item is the correspondence report that I have. Let me read it to you. There were no new membership requests. FIDNA EMS did not send us anything. Okay, the New York State DOH sent us the open meeting law status information. Of course, they sent it to us about a week late. And they sent us a statement that EMT basics may administer COVID vaccines. We received from Chevra Hatzalah Ambulance an operating certificate renewal. There are 5 enforcement actions. Let me read them. Will Davis, 450803, was issued a reprimand and placed on a 3-year probation, effective 9/2/2021, plus a $2,000 civil penalty. He's from Astoria, New York, so he may be in one of your squads. Eric Giesler, 406432, suspension stayed, $2,000 civil penalty from Scotia, New York. I have no idea where Scotia, New York is. Anybody know? Guess not. Timothy Leach, 418383, placed on 3-year probation effective 9/17/2021, $2,000 civil penalty, Blue Mountain Lake, New York. Kevin Stager, 479175, certification surrendered effective 8/24/2021, Beacon, New York. Thomas Warrington, 53962, certification revoked effective 9/13/2021, $10,000 civil penalty, Blue Mountain Lake, New York. There must be interesting things happening in Blue Mountain Lake. Okay, I really wish this is like so like tantalizing. They give us all the gossip and they don't tell us the details. What is that's worth $10,000? Anyway, okay. Next, moving on. Now, from EMS agencies, we received from Bensonhurst VAC, and I understand there are some individuals here from Bensonhurst VAC, and we received the following. Now, I'm not exactly sure the significance of this, and Marie is going to explain it, and then we'll ask someone from Bensonhurst to please chime in and let us know what is it exactly that they want. So we received from them CME info that they sent to the New York State DOH. They sent to us a copy of their EPI program. They sent to us an appeal regarding the New York State DOH continued suspension of operating certificate, and an email requesting the above letters be included in the REMSCO corresponding report, which they are. Okay, Marie, can you give us the background? And can everyone please mute yourself until you're ready to speak. Thank you. Marie, go ahead.
I spoke to Mr. Marquez briefly before the meeting. His main objective was to make sure that that the information that they've sent to Department of Health is documented in our minutes and in our correspondence, since they have not received any feedback from the New York State Department of Health. Now, I'm not sure what kind of feedback they're going to get because currently the agency is suspended. And I don't think that this is a council issue any longer. It's something that they have to deal with the Department of Health directly. Once Mr. Marquez speaks, if he does ask for assistance, if there's anyone here from the volunteer side that wants to review any of these documents and give him help, that would be a great thing. But that's it. It's pretty limited.
Okay, can you ask him to speak? I don't know where he is and how he's going to speak, but
He's on a phone number. Hold on, I've got the numbers right here. And I will unmute him. Just find it in email. Okay. Okay, Mike, I'm going to find you and unmute you. And then you can speak. Because he is 898. All right, Mike, you're not muted, so you can, well, you have to unmute yourself, Mr. Marquez. Can you do that?
Yes, this is Michael Marquez, Benson Arrest Ambulance. Can you hear me?
Yes.
Okay, I just wanted to follow up in terms of the correspondence report and the documentation that we submitted to REMSCO. We mailed this information to the New York State Department of Health, specifically our appeals request, our revised standard operating procedures, and some of our training programs. We're looking for input from the Department of Health to see whether or not those programs would meet the requirements of the regulations. We're moving forward towards coming into compliance and revising our procedures and policies. However, we want to make sure that any documentation that we submit, any procedures that we develop are in compliance before we implement them. Our goal is to make sure that we satisfy all the notices of violations that were issued and that we come into full compliance at the end of the suspension period.
okay. Well, they're certainly in the minutes now. Are you seeking someone to give you a hand reviewing these things?
I'm sorry, I didn't hear what you said. Can you please repeat that?
Are you asking for someone from this committee to volunteer to assist you in going through these documents? I don't think that Marie is the one who's going to go through these documents.
If there was someone who would be available to do that, we would appreciate the input and the help. However, I know that the New York State Department of Health would be the agency that would be responsible ultimately for approving it. And that's the reason why we directed the correspondence to them. So we're looking for some type of response from Department of Health to determine whether or not those documents are in compliance. And if they're not in compliance, we want to be able to make the necessary revisions and corrections to make sure that we are in compliance.
Understand, of course, that we have no control over the New York State DOH, nor can we force them to reply to you in a timely fashion. We do have a representative, I think, of DOH online. Maybe he wants to comment, maybe not. Maybe not.
Good evening. Can you hear me?
Yes, Mike.
Yes, Mike, go ahead.
Thank you. So, Mr. Marquez, if you're looking for any sort of responses from the department, I would suggest that you forward them to either my attention as directed in the letters or to your counsel to then direct them to the State Health Department. Other than that, I don't have any open-ended correspondence that I'm aware of, so we can settle that outside of this realm.
Sounds like a plan. Is there anything else on this matter?
Not at this time. Thank you.
Okay, thank you so much. Okay, we now move on, continuing. Now I saw a moment ago. Where is she?
Martina's here.
Martina's here. Where are you? Turn your camera on. There you are. Martina, you were supposed to call me the day after the last meeting to let me know, but I'm so happy you accepted. Are you ready to take over? She's holding
She's
her
not sure. We'll help you. If you don't like it, we'll talk about it after the meeting.
Do you have a copy of the agenda handy? I don't, you have to unmute yourself, Martina. There
So
you
you
go.
didn't hear a word that I said. Okay.
Not
I
a word.
actually
Let's
just,
start all
that
over.
one word. I am on my phone and I don't have access to my laptop right now. So no, I do not have a copy.
Okay.
I'm
so I
prepared on
guess
my first day.
let me help you with this. We're just doing the correspondence report. So I will continue to read this. The other item we received was a letter commemorating 9/11 from the New Milford, Connecticut Commission. Now, in terms of core sponsors, nothing new. We sent agendas, minutes, and the DOH, we sent recommendations to approve applications for transfer of operating authority. I recall last time we had approved all these things. ACE to AMR, Hunter Ambulance to GMR Event Services, which is AMR, Hunter EMS to GMR Event Services, which is AMR, and recommendation to deny approval of the application for the determination of public need for expansion of an existing ambulance agency, Bay Community Volunteer Ambulance Corps, Inc. Okay. We also just recently sent out a letter supporting the Mount Sinai Health System and the Icahn School of Medicine at Mount Sinai. They are applying to create a Region 2 regional disaster health response system for the U.S. Department of Health and Human Services. And we wrote them a letter of support, that is we meaning both the REMSCO and the REMAC, and we will be involved should they get that grant to create this Region 2 regional disaster health response system. Marie, do you want to say anything more about that? No. Okay. I saw she shook her head. We also
Sorry, I was muted.
okay. We also saw an email to DOH requesting clarification of vaccination mandate with regards to non-hospital-based EMS providers. Have we heard anything back?
I have not heard anything back. It was discussed at an online meeting on the 9th of September. And my recollection is that only hospital-based EMS providers must be vaccinated because they're part of the hospital staff. If you are part of a non-hospital-based ambulance service, you are excluded from this mandate. But I want to get that in writing. So as soon as I get it, I will be dispersing it to everyone in the region.
Okay, thank you. Okay, the next item is
Dr. Langston, I'm sorry, off the correspondence report, I did not include Chief Joseph Pataki, who is replacing Christine Mazzola as a council member and then as an ambulance member. So at the next meeting, we will officially accept him.
well, the ambulance committee. Okay, it's simply an appointment. So Martina, since you are the chair, your first official action is to accept him as a member of the ambulance committee. Unmute yourself, speak up.
Okay, I do accept.
Wonderful. And we will vote on REMSCO membership at the next meeting. Wonderful. Oh, by the way, I hope you're taking notes because you have to report all this to REMSCO. Okay. Next, on the agenda, review of applications for transfer of operating authority for determination of public need. I believe there were none. The ambulance committee tag reports. Did the tag actually meet, or is this just a question you're asking?
These are questions that I'm asking, but actually we forgot to take attendance. Can I just do a quick attendance for ambulance committee?
You may.
Okay. So this is the September 23rd ambulance committee meeting. Dove Jacob of Ari Weiss. Grace Cacciola.
I'm
Great.
here.
Mitch Powell or William Goffin.
I'm here.
Daniel Mizels. or Rory Gutman?
Jory Gutzman, I'm here.
Thank you. Robert Bristol,
I'm here.
John Johnstone,
Here.
Jerry Gelbart or David Mekatansky,
Here.
Travis Kessel or James Downey?
Here.
Great.
Both here.
Thank you. Scott Olansky? And Martina Barcarella? She wishes she
I'm
wasn't.
here.
Vincent Baranco?
Present and accounted for.
Okay. Nancy Benedetto?
I'm here.
Thank you. Udija Langsom
Present.
and Brian Levinsky.
Present.
Okay, and Doug Jacob or Ari Weiss, neither one is here, correct? Okay, we have a quorum.
We have a quorum. Thank you. The next item is to discuss this matter of the security stickers.
Yeah, this was a question I'd like
Question?
the tag to consider. When we first created the security stickers, there was a reason for them to be used by our police department or whatever departments to identify ambulances that are approved to operate in New York City. And it was just a second type of security identifier. And I've been speaking to a few people, and we wonder if this is really something that is used now or is necessary now. So I'd like the tag to take a look at whether we continue to need security stickers, and if we do, what are their purposes? What would be the reason for them to be displayed on the ambulances?
So I think this is something that the security tag should definitely discuss. I believe this is now 20 years old.
Yeah.
And you may all recall that in the aftermath of 911, when everybody and their uncle and aunts showed up on calls, there was significant issues of identifying who should be on the scene and who should not be on the scene. And in many cases, people who should be on the scene were not allowed on the scene. People who shouldn't be on the scene were allowed on the scene, and we had complete chaos. So we introduced the concept of a security tag. Now, the security tag, the security sticker is only as good if the people who control the scene, i.e. PD and fire department, look for them. So I think that would be the first step, to find out from the police department and the fire department whether they are still have this in their protocol to check. If they don't, and unless they have something better in mind, we should remind them that 20 years ago, there was a real chaos on the scenes. And it wasn't only 911, it was also the plane crash in, where was it? In
Queens?
In Queens.
Rockaways, I think.
Had many people showing up who shouldn't have been there, and there were a lot of complaints. So I think we need to have something, whether it's this particular security sticker, whether it was an ID or some kind, but first step is for the security tag. Who is whom? Who is on the security tag?
I believe Vincent Branco is the chair of that tag.
And
I have a list. I know one of the other people is Scott Orlansky. I'm not sure who else is on there. And someone from fire department. So it would be Grace or Joseph Pataki at this point.
okay, so Vincent, can you call your tag together and start discussing this issue? Vincent?
Sure, no problem. I will reach out to Marie during the week, identify personnel. I believe it was one representative from each sector.
Yes.
And we can reconvene. And it's been a long time, and it's been 20 years. So we should really investigate that.
And I think IDs go along with this as well. I mean, they somewhat overlap. And I think you had something to do with that tag too.
No, I wasn't part of the tag with the IDs, but the IDs, I don't think really took over 100%, if you know what I mean. Some people got ID, some people didn't.
Okay, in any event, can I ask you to have a preliminary report for the next meeting of the ambulance committee?
Sure, I will work on that just for you.
No, it's Martina
Okay.
now our new chair. Okay, for me too, but for her. Okay, there is no unfinished business that I'm aware of.
No.
And we took care of the new business discussing Bensonhurst VAC, but there are two other items. One of them is the question of BLS first response agencies without New York State DOH approval. Marie, you want to present this, please?
Yes. About 20 years ago, the REMACs were empowered regionally to approve BLS first response agencies, and we did that for a while. But since then, the Department of Health now has even though it's not regulated in Article 30, they do have a process that BLS first response agencies must meet. There's an application. And all of our agencies, except for one in New York City, all of our BLS first response agencies have submitted applications and either gotten approval or gotten denied. We have one agency left, and it's Emergency Medical Rescue. It's been around a long time, but the liability for REMSCO and REMAC to continue this unregulated approval of an agency that we really have no oversight over, I think is too high. And we need to put a timeline on this and give Emergency Medical Rescue 30 to 60 days to get their application up to New York State Department of Health, get it processed and approved or not approved, whatever, and remove our permission for them to operate in New York City, since we really have no knowledge of how they're operating. They don't even submit PCRs. They're not allowed to because they don't have an agency code. So I just wanted to bring this forward to discuss, and my recommendation is that we give them 60 days to get their house in order.
Are there any other BLS first response agencies in our region who we currently approve?
Yes, we have there are a few of them. Oh gosh, well, one of them was Ezra's Nosh, and they still function, but there is a municipal BLS first response. I don't have my list in front of me, but I can send it out. There aren't many, there are 3 or 4.
What's the nature of our supervision of them now?
We don't really supervise them because they submit EPCRs and their data is submitted to the New York State Department of Health so that we know if they're functioning and what they're doing.
But we have no other role. Dr. Schenker, is that correct, that the REMAC also does not do anything with these BLS first response agencies? Dr. Schenker, usually you talk on mute.
He's probably busy doing another job.
I understand. There's a picture there, but he doesn't talk. Okay. Anyone else have any comments on this?
There is a hand raised by Travis Kessler.
Okay. Go ahead, Travis. Unmute yourself, please.
There we go. Just in terms of some of the things we've come across and that have been brought to our attention, that kind of gray area where the REMSCO doesn't have the enforcement arm, because the state does, allows for people to freelance quite a bit. There's been some agencies that aren't even REMSCO recognized that have tried to hide underneath that clout. So it's definitely, in our opinion, that the state recognition is necessary, and that we really shouldn't be recognizing any first response agencies that don't have that state certification.
Anyone else?
This is Jim Downey. There are agents or corporations or whatever
that incorporate from time to time and hold themselves out as with the name of an ambulance or EMS first response agency. They pop up from time to time and you don't see them after a while, but the corporation still exists. And there are a number of them. I can send you a whole list of names that I've seen over the past couple of years.
So may I make a suggestion? So we're even-handed to every organization. Jim, if you can send that list to Marie, and then Marie can send a standard letter to all of those corporations, okay, and say to them, within 60 days, you need to apply to the state. Otherwise, we are sending the state an email that we do not have any responsibility for the agency. Does that sound fair enough for the committee? Somebody say yes or no.
We really should have a vote on something like this.
I don't know if that
I want to hear
requires,
first discussion.
I don't know if that requires a motion, but I'll second the motion for a 60-day window to the REMSCO no longer recognizing the organization unless they apply for state approval.
Now, all the organizations, the whole list that Jim is going to provide us.
Yes, I think on Jim's list, though, there are a bunch of agencies that are neither REMSCO nor state recognized. I think that oddly enough,
We should let them know that we don't recognize them. We
Yeah,
probably
there's
should
only-
remind them that we don't recognize you.
Would it be beneficial if the REMSCO just eliminated the whole entire process of recognizing a BLS first response agency altogether and just say that we defer to the certification or whatever process by New York State? That would absolve kind of responsibility for everyone. It's just a blanket statement that as of X date, the REMSCO doesn't recognize this level of service. All providers should meet the requirements set forth by New York State.
Are we allowed to do that, Marie, or do we have some requirements?
I believe that part of the application process with the state requires a REMAC approval of the medical side of their application. They need some kind of support from the region for them to be able to send in an application. But we don't give the ultimate approval.
Is it possible to say that we will continue to support agencies that apply, but the REMSCO does not independently recognize any first response agency?
I'm reading the notice now. What is this? Policy 0604. And agencies making applications in New York State DOH for recognition of BLS-FR will be required to submit proof of local EMS system participation to their REMSCO for evaluation and written endorsement.
Okay, then I guess we have no choice.
Yep.
If that policy is still in effect, we have to go ahead. So I think the motion down on the floor is the right motion right now. We go through the list to say you got 60 days, otherwise we're right to the state that we don't endorse you. Any further?
For organizations not certified by the DOH, should there be a time limit that REMSCO recognizes them before they have to reapply to be recognized by this body again?
I'm sorry, what was that? What did you?
Oh, I was asking for organizations that don't have their BLS and are not yet certified by the DOH. If we seem to have a list of organizations that we recognize but still are not certified, should there be a time limit that we give recognition until they receive their certification, at which point they would have to reapply for recognition from REMSCO?
60 days sounds like the number we were talking about.
Yeah.
Well, I know 60 days is for this situation that you have to apply, but moving forward, if there's organizations that, are outstanding, should there be a time limit that you're granted recognition for a year while your application's pending or whatever number it may be?
I don't think so.
No.
Because that would allow people to pop up and say, hey, I'm running an ambulance out of my garage or a first response agency without any whatsoever. I wouldn't think it's a good idea. Okay, hearing no further discussion, let us call for a vote on the motion, which is to notify all the current BLS first response agency corporations who do not have New York State DOH approval. They've got 60 days to apply, or we will write to the state that we do not recognize them. Can we take a roll call vote, please?
Sure. Give me 1 second. Sorry, just pulling up my attendance list.
This is Jim Downey again. Does an agency or organization have to have approval from anybody to operate as a BLS first response agency?
Well, it's not regulated in Article 30, so anybody can do whatever they want. But the EMTs or paramedics working on that BLS, non-regulated BLS first response agency are putting their personal certifications at risk if they are going to be operating outside of the system. And that's beyond our control.
Okay.
Okay, so I'm doing a roll call vote to approve the sending of this letter to the agencies. And please answer in favor, opposed, or abstain. Okay, Dove Jacob, Ari Weiss. Grace Cacciola.
In favor.
Thank you. Mitch Powell, William Goffin,
In favor.
Rory Gutzman.
In favor.
Did I pronounce your name correctly?
Jory with a J.
Jory, okay.
Yeah.
You'll learn, I mispronounce everything. Robert Bristol,
In favor.
John Johnstone,
In favor.
Travis Kessel,
Travis Kessel, in favor.
Scott Orlansky, Vincent Morocco,
In favor.
Nancy Benedetto,
In favor.
Yadidja Langsam, Brian Levinsky,
In favor.
and Martina Barcarella.
In favor.
Okay, so the motion carries.
I'm in favor too.
Thank you.
Who's in favor too? Who's that?
Katansky.
Oh, okay, I only called, you're entitled to one vote. It's either you, oh, I didn't call you at all. Thank you, sorry.
No worries.
Okay,
Okay,
So
so
motion carries.
we'll present this as a seconded motion to the REMSCO, and then we'll have the same discussion. Okay, there is no other new business that I'm aware of.
well, okay. What do I have on the agenda? I just wanted to,
Oh, yes, you have New York State DOH mobilization request. Want to tell us
Yeah.
about?
yeah, I'm just a little perturbed with the New York State Department of Health. I understand that they mobilize and do all kinds of great stuff. So every once in a while, we get these mobilization requests that we've been sending out to the agencies. We received one today, or actually yesterday, for a September 2021 EMS mobilization contract polling survey. And this is to find out who is going to be available to provide ALS units throughout the state, and specifically within 7 sites in the metropolitan area until June of 2022. And I asked the state, I said, can you give us a little more information on what is this activation about? Especially since if they do this kind of a contract, they're going to be pulling resources out of New York City. It would be nice if we understood what was the purpose of this, what is going on. And I haven't received a response yet. And I certainly don't want to cause problems with the New York State Department of Health that we don't already have. But it's something that should include the regions, and we should be discussing these types of statewide mobilizations that are directly going to affect our ability to provide EMS within our own regions. Especially they're asking for ALS resources, and those are really limited. So I just wanted to bring it forward here and to the REMSCO so that we can figure out a politically correct way to approach the state, since I feel like I'm no longer capable of doing that nicely.
It might be that we write them a nice, polite letter, just to go on record.
Okay, but I want everyone to be aware of it, that this is going on.
Anybody else have any other new business? And the REMSCO meeting meets at 5. Martina, would you like to accept from someone, ask if someone has a motion to adjourn, and we will be back at 5, at 6 rather, sorry, at 6.
Motion to adjourn. Anyone?
I
I'll make a
second that motion.
Seconded.
Okay,
I
well,
second it. You did a great job, Martina.
Thank you.
She's got to start somewhere. I'll pull together some notes for you, Martina, and I'm going to email them to you. Can your phone get anything at all?
Yes, I'll forward them to my work phone. Yes, thank
Okay.
you.
Okay, I'll put something together now. Okay, so everyone, we will see you in 20 minutes.
right, okay, you can turn off your videos and walk around, or stay on, or whatever. Charlie, you might want to stop recording and stop the live feed for now.
The feed would just still be running. I have put up a waiting screen for it, just
Yeah.
because stopping the stream creates a new link that has to be redistributed for
No
the public.
problem, do that, smart move. Thank you.
You're welcome.
Are we getting ready to start?
We can as soon as you'd like to.
Okay, let's see how many people are here.
Why don't you take an unofficial look down the list to make sure that we have a quorum, and then we'll start.
Give me a second.
Marie, people who don't have their names here, legally, they can't participate. It would be nice if everyone who changed their name, whoever's iPhone, please rename yourself. Otherwise, you're going to have to ask them to leave, or you're going to have to remove them.
Yeah,
Unnamed people sitting at a meeting.
yeah, right now I only see one phone number.
Yeah, but there's someone who's named themselves iPhone.
Oh. Oh, I believe Dennis's iPad is Dennis Laurie. Is Samia here? I'm just doing a quick count.
Oh, hi, it's Rob Bristol from Emergency Management. It seems that iPhone is me. I'll try to change it, but I'm driving. My apologies.
Right click and change your name.
Relax here. Yes.
Charlie, can you make me a co-host as well so I can mute people when they shouldn't be talking?
Okay, we have 22 people here. We have a quorum.
Okay. Okay, ladies and gentlemen, I'd like to call to order the Tuesday, July 27th, 2021. Not what am I talking about?
Huh.
What did you put on your agenda?
Did I have the wrong date on there?
Yes. Okay, I'd like to call to order the September 23rd, 2021 meeting of the New York City Regional EMS Council. The first item that we are going to do is to have a roll call vote, a roll call attendance.
Okay. Please answer when I call your name. Dove Jacob. Ari Weiss. Grace Cacciola.
Here.
Bradley Kaufman. I know that Chief Pataki is there, but we have to wait until after he's officially put on the committee. Samia McEachin.
Here.
William Goffin. Or Dominic Battinelli.
President,
Oh, Bill's there. Thank you.
here.
Jory Gutzman.
Present.
Robert Bristol.
Present.
John Johnstone.
Present.
Travis Kessel.
Here.
David Mikatansky.
Here.
Joseph Schenker. David Benelli,
Here.
Scott Orlansky, Morty Lax,
I'm here.
Martina Baccarella,
I'm here.
Vincent Baranco,
Present and accounted for.
Nancy Benedetto. I think Nancy's driving. Arthur Cooper,
Here.
Robert Krupe asked to be excused. Megan Kessel,
Here.
Manfred Fuchs. Man, are you there? You're muted, Manny. Okay, we'll come back to Manny. Sean Graves, Jerry Gumbo,
Here.
thank you. Yadidra Langsam, Dr. Langsam, I see you there.
Present.
Thank you. Brian Levinsky,
Present.
Dennis Laurie,
Present.
Mitch Powell.
Present.
Okay, we have a quorum.
Thank you very much. Okay, the first item on the agenda is an explanation of how we're meeting today. You may recall that the previous governor issued an executive order allowing during the COVID-19 pandemic for meetings subject to the open meeting law to meet via Zoom, provided that the meeting is both recorded and live streamed. As you can see from the upper left-hand corner, we are recording and we are live streaming. But of course, the governor decided that COVID-19 was no longer an issue and he removed his executive order. So we actually had to have a meeting in person. The new governor reinstated the executive order with a sunset date of January, mid-January. So until that time, we will continue to meet via Zoom, provided that we record and live stream, which we are doing. Okay, the first item on the agenda is the approval of the July 27th, 2021 meeting minutes. Please note that anything on the chat is not valid. You must speak up so that you can be recorded and live stream. Okay, the minutes have been distributed. Are there any corrections, additions, comments? Hearing none, a motion to approve the minutes is in order. Somebody unmute yourself.
Motion, Vincent Baranco.
Thank you. Is there a second?
I'll second it.
Thank you. Is there anyone who votes not to approve the minutes? Is there anyone who abstains on the minutes? We will therefore consider the minutes to have been approved unanimously. We now move to the correspondence report. Give me a moment. Okay, the correspondence report. There were no new membership requests, no new information received from Fidney EMS. New York State DOH sent us the status of the open meeting law, which I just explained. They sent us a statement that EMT Basics may administer COVID vaccines. We received from Chevra Hatzalah Ambulance operating certificate renewal and the following enforcement actions. I will read them into the record. Will Davis, 450803, issued a reprimand placed on a 3-year probation effective 9/2/2021, $2,000 civil penalty from Astoria, New York. Eric Giesler, 406432, suspension stayed, $2,000 civil penalty, Scotia, New York. Timothy Leach, 418383, placed on 3-year probation effective 9/17/2021, $2,000 civil penalty, Blue Mountain Lake, New York. Kevin Stager, 479175, certification surrendered effective 8/24/2021, Beacon, New York. And Thomas Warrington, 53962, certification 2021, $10,000 civil penalty, Blue Mountain Lake, New York. Okay. We received from Bensonhurst VAC regarding its suspension the following items: a CME information that was sent to New York State DOH, EPI program, the appeal regarding the New York State DOH continued suspension of operating certificate, and an email request the above letters be included in REMSCO's correspondence report. We have done that. They are in the correspondence report. It's duly noted. We had a little discussion in the ambulance committee about this. There's nothing much that we can do other than note that this is here, and we look forward to them correcting all these actions and moving forward. We also received a letter commemorating the 9/11 from New Milford, Connecticut Commission. Okay, there's nothing new from core sponsors. The office sent out agendas, minutes, and associated attachments. To the DOH, we sent out recommendations to approve transfer of operating authority from ACE to AMR, from Hunter Ambulance to GMR Event Services AMR, Hunter EMS to GMR Event Services to AMR, recommendation to deny approval of the application for determination of public need for expansion of an existing ambulance agency, Bay Community Volunteer Ambulance Corps, Inc. We also just recently sent out a letter supporting the Mount Sinai Health System and the Icahn School of Medicine at Mount Sinai, their application to create a Region 2 regional disaster health response system for the U.S. Department of Health and Human Services, Office of the Assistant Secretary of Preparedness and Response. Both the REMAC and the REMSCO sent out a letter supporting this, and hopefully they will get this grant. And we also sent an email to DOH requesting clarification of vaccination mandate with regards to non-hospital-based EMS providers. Marie, would you please elaborate on this?
Yes, I sent a request to Peter Brody to ask him to put in writing with regards to whether our EMS providers have to be vaccinated. And from what I recall from a past meeting on September 9th, which was I think it was an EMS leadership meeting with the Department of Health, they did state that if you're an EMS provider that is affiliated or owned by a hospital and hospital staff have to be vaccinated, then the EMS staff also have to be vaccinated. If your ambulance agency is a private ambulance or volunteer ambulance, then no, you do not. There is no mandate for the EMS providers attached to those services. But I'm trying to get it in writing so that I can disseminate it to the region.
Thank you very much. Are there any questions on the correspondence report?
I have one addition, Dr. Langston. I excluded the fire department requesting Chief Joseph Pataki to replace Christine Mazzola.
I was going to get to that in 1 second.
Okay.
1 second. Are there any questions on the correspondence report? Okay, we have now, Marie, a request.
Wait, Yedidia, I raised my hand.
I'm sorry, I don't say. Go ahead, Dr. Benelli. I apologize. Go.
So I'm fully supportive of the Mount Sinai request with regarding to disaster preparedness. But was this discussed in REMAC? Because I don't recall that.
No, this was not discussed in a meeting. This was a correspondence item that came to both the chair of REMAC and the chair of REMSCO, and we agreed of the two chairs. This was not discussed.
Thank you.
You're welcome. Any other questions on the correspondence report? Hearing none, Marie, we have a proposal for a new member. Please, now go ahead.
Okay, this is from the fire department. As many people know, Christine Mazzola has happily retired, and we wish her the best. Her replacement will be Chief Joseph Pataki. He's actually here this evening, but I need a vote to officially place him on the regional council.
Very good. Chief Pataki, do you have a video so we can see who you are? Be nice. Very good. Hi. Okay. Is there any discussion on endorsing the Fidney's request to make Chief Pataki a member of the REMSCO?
Question, is the chief a resident of New York City?
As of 6 months ago, I am not. I am a longtime resident for 20 years of Brooklyn, but I currently reside in Long Island.
But
that's going to be an issue?
Yes, that will be an issue because the primary members of regional council must be New York City residents. Their alternates do not have to be. So Chief Pataki, you can have yourself assigned as an alternate, but your primary has to be a New York City resident.
Okay,
Is
Marie.
Cacciola assigned as a primary?
Excuse me?
Is Chief Cacciola on, and is she assigned as a primary?
She is the primary, but you have, okay, hold on a second. Let me just close that. Yeah, you have two positions. You have Chief Cacciola is in one position already, and the secondary position was to be yours.
Hey, Marie, we can't discuss this now. You must write a letter to Fidney reminding them that the primary member has to be a resident and that Chief Pataki can certainly be the alternate to that member.
Okay, I'll reach out to you offline, Chief.
Very good. So let's move on. The next item.
I'm sorry. Yeah, Marie, we can discuss tomorrow.
Yes, yes.
Yeah, I'm sure this will be done 1, 2, 3. Okay. Staff report. Emergency preparedness update. Scott.
Yes, good evening. The staff continue to work with state dishes and agencies on the DR 4480 New York COVID-19 NAC activation reimbursement. The District 18 Director, Jerry Gilbart, and SVERA leadership are aware and have been working with REMSCO as well as on this process. Squads with either related damage are advised to go through their own insurance company first before applying for FEMA relief to reduce the possibilities of having the claims denied. Most important is to keep good records on what was spent post-flood damage to apparatus and building. At this time, we have not received any directions from dishes on the request for public assistance like we had post-Superstorm Sandy, but staff will continue to follow up with dishes on this matter. End the report.
Are there any questions for Scott? Hearing none, we move to program agency update. Marie.
There is not that much to report. The program agency is still waiting for significant funds from last year's contract. We understand the state is working on that, so hopefully we'll get that money shortly. We'll be vouchering for this first quarter, which ends September 30th. We have been working, the Department of Health has been sending out different training courses, and we've sent staff to go to mental health courses and leadership courses. And that's all the information I have right now for program agency.
Are there any questions for Marie on program agency report? Okay, it gives me great pleasure to introduce someone who you all know. Martina Baccarello has agreed to chair the ambulance committee, and I agreed that I would help her do it. But anyway, the floor is yours. Please report on the meeting that we just had.
Good evening, everyone. Ambulance Committee met on Thursday, September 23rd of 2021, and we had a few things that we discussed. The first one is the transfer of operating authority applications. There was none. No certificate of needs filed either. And then we discussed the security sticker tags. This will be reviewed. Vincent Barranco did say that he was going to compile a preliminary report on the tag status. Thank you, Vinny. The New York State Department of Health has also requested that New York City REMSCO distribute mobilization contracting survey to all regional ambulance agencies. The purpose contracts are through June 2022 for all ALS ambulances. The New York State Department of Health has also asked to identify the purpose of mobilization, specifically because they will be using New York City ALS resources. New York State Department of Health has not communicated the purpose of the mobilization to any region council. The next item was also second motion. New York State Department of Health approved BLS first response agencies in New York City that they have 60 days to submit applications to New York State Department of Health for official approval. After that, New York State REMSCO will withdraw any endorsements and notify New York State Department of Health, and that requires a roll call vote.
This came as a seconded motion from the Ambulance Committee. And the first thing you have to do is ask if there's any discussion or explanation for this.
Is there any discussion or explanation for this?
Do you want maybe to give your little explanation? What's going on?
Okay. In the past, the REMAC and REMSCO were allowed to approve BLS first response agencies in New York City, and we did that. We no longer are allowed to do that, and most of our agencies have already received approval. They've gone through the process and they have put their applications to New York State DOH, and they received an agency code and are officially approved and under the purview of the New York State Department of Health. We have a few agencies here in New York City, but one of which we gave approval to many, many years ago, probably 2 decades ago, to operate as a BLS first response. And they still have not submitted an application, and that puts us at risk. There's a bit of liability attached to us supporting an agency that is not approved by the New York State Department of Health. We have no way of overseeing them. They're not required to submit, they're not allowed to submit PCRs because they don't have an agency code. So there's no way for us to oversee it. And what we were requesting is that these existing agencies that are not approved by New York State Department of Health, James Downey is actually going to provide us with a list of agencies that he knows about through the volunteer sector. We'll be sending them letters and letting them know they have 60 days to submit the New York State application so they can get approved. After that time, we are going to tell the Department of Health that we no longer endorse these agencies so that our risk and liability is eliminated. They can choose to continue operating, but they will not operate under our purview. Any questions? They're all listening to the rain outside.
Okay, if there are no questions, Martina, ask Marie to do a roll call vote.
Marie, may you please do a roll call vote?
Yes, I will. Okay, so please answer in favor, oppose, or abstain. Dub Jacob, Harry Weiss, Grace Cacciola.
In favor.
Bradley Kaufman. Samia McEachin.
In favor.
William Goffin.
In favor.
Daniel Mizels.
In favor.
Robert Bristol.
In favor.
Okay. John Stone,
In favor.
Travis Kessel,
In favor.
David Mekatansky,
In favor.
Joseph Schenker,
All right.
In favor.
You may close it out.
Scott Orlansky, Morty Lax,
In favor.
Vincent Barranco,
In favor.
Martina Barcarella,
In favor.
Nancy Benedetto, Arthur Cooper,
In favor.
Robert Krupe, Megan Kessel,
In favor.
Manfred Fuchs. Thank you.
In favor.
Thanks. Sean Graves, Jerry Gumbo,
In favor.
Dennis Laurie,
In favor.
Brian Levinsky,
In favor.
Mitch Powell,
In favor.
and Chairperson, would you like to vote? Dr.
Yeah.
Langston?
In favor.
Okay, so it appears unanimous for the members present. Motion carries.
There's someone in the waiting room. Do we know who it is? It's with a phone number. Okay,
I don't see the waiting room.
well, I don't know. Anyway, yeah, someone let him in, and we don't let people in with phone numbers.
This is Nancy. I finally figured out how to get myself unmuted. Don't
So
laugh.
Nancy, how do you vote?
Yeah, I've been here. I voted in favor.
Oh,
Thank you.
Nancy, now we know who it is. Very excellent. Welcome.
Thank you.
Okay, Martina, is there anything else from the Ambulance Committee?
No, that was all.
Wonderful job. Thank you. Welcome. Great.
Thank you very much.
Okay, we now move to the Training Education Committee. Morty?
So Training and Ed is going to be hopefully in the coming weeks completing the protocol update training. We hope to have that up on Vital Signs Academy. We have the fire department's materials, and we thank them for providing that. So this way we can remain in sync regionally across the spectrum. There was a certified instructor update course hosted by a very successful one, I might add. I think there were about 80 people on, close to 80 people on that CIU, which is excellent. And it was hosted by BMCC, and thanks to Megan Williams for that. And it was the PC, Bill Powell. And it actually provided a pretty good model to run these more often online here virtually, as long as the Department of Health, who seems to support it, continues to support that model. So thank you to them. And you should be hearing from us shortly with materials for training.
Thank you. Are there any questions for Morty? Thank you, and thank your committee. Nancy, that looks to me like you have a question? No. Okay. Yes? No?
No.
No. Okay, that's all the time. So you should mute the background noise. I'll do it. I'll mute you. Okay. Next item on the agenda is the REMAC report. Dr. Schenker.
Good evening, everyone. I don't actually have, Marie, did you send me the actual report? Because if not, I can just fly by the seat of my pants, which I'm really good at.
I sent you the minutes of the REMAC meeting
When was that?
this morning.
Oh, okay. Yeah, so, I have it right here. No problem, everybody. I mean, flying by the seat of my pants is usually more fun, but I actually have minutes, so I will go through them. Okay, we met on September 9th, which was, I believe, last Thursday. Just going through the action items here. There was the bulk of what was presented. We reviewed the test results for the REMAC All-MC exam. This is the physician exam, has a 95% pass rate. It really is designed to help physicians appreciate what the protocols are. That was the breakdown for that. The main exam has approximately an 80% first try pass rate. And they are continuously reviewing all the questions and going through it as the new protocols update. Protocol committee presented new fire department HAZTAC and rescue protocols. These were approved at REMAC and will be going up to CMAC for approval. The revisions, the largest revisions relate to cyanide exposure and organophosphate management in the case that there's not enough volume to make a class order. So if there's not a class order yet, how could they manage and treat 1 or 2 patients? And that was the presentation from the protocol committee. There was a discussion on ketamine use and excited delirium, which will continue. There was also a discussion from the interfacility tag, which will be, there are 6 segments to the project: level of care and scope of practice, education and credentialing, protocols and procedures, medical direction, quality, and operations. That is ongoing, as is the ECMO tag, which is still in process. The QA committee reported on the aims for the year, which is on scene time for suspected stroke, with a reduction of 10% over 6 months, an increase in the percentage of stroke calls in which blood glucose were obtained. So it went from 79 to 85. We're looking to increase that even more. The percentage of atraumatic chest pain patients over 35 in which an EKG is obtained. That's another thing. And we will continue to explore and look at First Watch as a regional tool, which is a grant for the 911 system, but we are trying to figure out ways to make it available for the rest of the system. And I believe those were all the action items. Any questions? We did have a discussion on one more last thing. We did have a discussion, and this was based on the recent passing of a paramedic, Rebecca Solomon from Maimonides, who took her own life. We did have a discussion about how to best approach stress management and the risks that our providers have with regards to suicide and mental health in the job that we do. We are forming a joint REMAC and REMSCO tag, which will be chaired by Dr. Krupe. Bob, if you don't know that, congratulations. To review how to best approach this from a more global perspective, not just after action, but more how to manage it prior to incidents occurring. So that is something that if anybody here is interested in, please let Marie or myself or you know, and we will get you on the meeting. Also, Dr. Munjal mentioned that Friday, I guess it's past already. What day is it today? Yeah, Friday, September 17th was the New York Mobile Integrated Healthcare Conference, for those of you who had an opportunity to attend. And that concludes my report. The next meeting is on October 19th, I believe. Thank you.
Any questions? Dr. Schenker? Hearing none. Someone is squeaking in the background.
It could be somebody in my house. There's like 1 million people here having a barbecue.
Oh, okay. So mute yourself. Next.
I was speaking.
Now mute yourself.
All right. Well, I'm actually going to drop off, everybody, but happy holidays for those of you who are celebrating. For those of you who are not, I'll see you at the next meeting. And
Okay.
David is here if there's any questions, I guess, going forward.
Quality Improvement Committee report, who's giving that?
Actually, didn't Dr. Schenker just do that as part of REMAC? Unless, if Joe's here and he wants to give any more information. I'm not sure. Yes, Joe is here.
No, I think Joe left, but I think that Joe really summarized very well in the REMAC report, the quality committee report. There were no other action items ever reported from the quality committee.
Yeah, Joe is on, it seems.
Yeah.
Joe, can you give the quality, a quick overview of the Quality Improvement Committee?
He probably stepped away.
Oh, no, he's
Are you talking for me or Dr. Schenker still?
Oh, Schenker's gone. He went to barbecue. Did you?
Joe Ranieri.
Didn't you see that he was wearing he was wearing a barbecue thing while he was giving us our meeting? Go ahead, Dr.
He's a man doing many things at many times. So, so the Quality Improvement Committee is moving along well with its 2021 QA project. We completed our data collection period, looking at improvement on some areas of stroke and STEMI. So we should be hopefully having a report, a formalized report completed by the next QA committee, and then we'll report on that at the next REMSCO committee in October. Once that is completed, we'll be working with the Training and Ed Committee to put out some action items, as well as the REMAC to put out some action items and interventions to push out to the region along with some guidance.
Thank you. Anything else?
No, sir. That would be all.
Are there any questions for Mr. Ranieri? Hearing none, we move to the State EMS Council report, which did not yet meet. So I still don't know, Marie, do you have any indication whether they're going to be meeting by Zoom or in person?
Right now, they're still meeting in person, but that can change at any time. And I will let you know as soon as I hear.
Okay.
I think at the least, it's going to be hybrid. So if you don't want to travel up north, we could probably just go on virtually.
I just want to know, I don't want to drive there and then show up to see that there's no meeting.
Yeah, and neither do I.
Okay, next. I am not aware of any unfinished business.
I just want to bring up some information. As many of you know, the mental health team is, we're training potential members. If anyone here would like to participate, get free training, please reach out to your personnel. We're having classes everywhere, Brooklyn, Queens. Hopefully, if Morty can find a space in the Bronx, we'll have it at his place too. I need to have a team of at least 100 people, and they're being taught suicide prevention, ways to educate our providers so that people become aware of the signs and symptoms to look for in your partners and family, so that we can hopefully prevent some of the suicides. We did have a suicide last month of a young woman, Rebecca Solomons from Maimonides. And it's really tragic that people just, we're losing too many of our people, and we want to provide whatever we can to try and reduce that. And our team did go out to Maimonides to support them, and they were very grateful for the support there. The whole garage was really broken up about the suicide. So if you're interested in training and becoming part of our team, let me know and we will put you into a class. That's it.
I spoke with Georgia today. It'll probably be in November in the Bronx.
Great, thank you.
Let this topic. Okay, is there any new business? I'm not aware of any new business, in which case I thank you all very, very much for participating this evening. A motion to adjourn is in order. Somebody?
Motion to adjourn.
I'll second that motion.
Okay, we've got a motion and a second. We are adjourned. Happy holidays to those who are celebrating and to those who are not. Enjoy it until we see you next. Bye.
Happy holidays.
Happy holidays. Bye-bye.
Bye.
Tina, thank you again.
Thank you.
It wasn't so horrible, right? Well, it was a little horrible.